can you please tell me a little bit about yourself, your name, and where you live and work?
My name is Timothy Sharp, Tim Sharp. I live here in Sydney and work in the city in Sydney.
Right, and what do you do?
I wear a couple of different hats. So my background is actually in clinical psychology, and I still own and operate and run a small clinical psychology practice. That's a traditional clinical psychology practice, so we treat people with depression, anxiety, relationship difficulties, all the usual stuff.
Yeah, yeah.
So that was the first half of my career, and I still do a bit of it. I spend most of my time heading up an organisation I started called the Happiness Institute, which is a positive psychology practice. So that's where I spend the bulk of my time currently. Within that is another small practice called Positive Leadership Development, which is really just the corporate arm of the Happiness Institute. So it's the same, it's based on positive psychology and leadership principles, but we work mainly with senior executives and organisations. And then I wear two academic hats. I have adjunct professor appointments at UTS Business School, which is one of the universities here in Sydney, and also RMIT Health Sciences, which is a university down in Victoria. So I'm clinical psychologist, positive psychology coach, and academic, I guess, but most of my time is as a coach, facilitator, speaker within the Happiness Institute.
Right. And how did you get into that? What's your background?
Well, my background, as I said, is in clinical psychology, so I started off on a pretty traditional route, and or here in Australia anyway, I did an undergrad degree, so I did a BSc, a Bachelor of Science with honours in psychology, then I did a clinical master's degree, and then I did a PhD, all in clinical psychology. I worked as a clinical psychologist for about 10 years or so.
Yeah.
And around that time I went off into private, so that was mainly in the public hospital system, our public health system. Around, or a bit over 10 years ago, probably 12 or 13 years ago now, I went into private practice, still as a clinical psychologist, but only a few years later discovered positive psychology and coaching, and that then very much started to influence not just what I do, but I guess even who I am as a person, I think. So I came into positive psychology coaching through clinical psychology, and I suppose the first point of entry was through Martin Seligman's early work.
And you say it influenced the way you work and you as a person. Can you just say just a few more words on that?
Yeah, well, I suppose when I first started in psychology, like most people, I suppose I wanted to help people. But I had an interest in sports psychology. But here in Australia, there weren't many opportunities to study sports psychology or performance psychology, and certainly 20 years ago, whatever it was, well, there still really aren't that many courses. But my interest in sports and performance psychology was wanting to understand what made elite athletes elite. Why were the best so good? And then I got sidetracked, I suppose, into clinical psychology, which I loved. But what I came to realise, and what a lot of positive psychologists realise, is that clinical and counselling psychology isn't really about the best. It's actually about the worst.
Yeah.
So when I discovered positive psychology, or when it was born, so to speak, it was like this is what I'd been looking for 15 years.
Yeah.
And it was was like, wow, this is what I'd always wanted to do and what I can do from now on. And although I still love clinical psychology, I think it's still very satisfying, and I still thoroughly enjoy helping people who are distressed. The idea of finding the best in people and helping them be their best, as opposed to treating problems, and is much more, for me anyway, much more fulfilling and exciting, I suppose.
Yeah. And the people that you typically coach when you coach them or facilitate groups, is that individuals or groups? Yeah.
Well, it's very varied, and one of the things I've learned about myself professionally over the years is that I like variety. So I do one-on-one coaching, and I still do some one-on-one therapy, and that's quite broad. So that could be anyone from still with levels of psychopathology, with depression and anxiety disorders, and lately I've been working quite a lot with weight problems, with obesity, and but through to very high functioning senior executives who don't have psychopathology, who aren't distressed or dysfunctional in any way, but who want to be better. So I do a bit of that one-on-one, which I enjoy, but I do a lot of group work. So we run quite a lot of small to medium-sized groups, sort of 20 to 30, and that's more facilitation, I suppose, or group coaching facilitation, and I really enjoy that as well. But I also do a lot of keynote speaking, so speaking at conferences that could be anything from 100 people to a couple of thousand people, depending on what it is. And I write, and so I like the variety. I like sitting one-on-one with someone, and in many ways that's the most fulfilling thing I do, because I suppose you can most directly see the influence you're having. Yeah. But I quite like getting up in front of a couple of thousand people too. I mean, that's exciting and it's fun, and I wouldn't want to do any of them full time. No. I like doing a bit of each of them. So I suppose my challenge over the last few years is trying to get the balance right.
Yeah.
Sometimes it goes too far one way and too far the other way, but I'm constantly sort of trying to get the right balance for me, and because I do like doing all of those things.
Yeah, yeah. And the people that you typically coach, what challenges do they bring?
Well, look, I think in some ways they're all the same, but in other ways they're all different. Certainly everyone's different. Every person that walks in the door, or certainly if I'm speaking to if there's 1,000 people in the audience, they're obviously not all the same person. So, but I suppose if I had to try and find a common element, and I'm a bit reluctant because they are all different, but I suppose the common element, I think in some ways, is the belief that I can change, or their belief that they can change. So I've always had a particular fascination and a very strong belief in the importance of self-efficacy.
Yeah.
And in many ways, although I don't like to pin anything down to just one thing, I don't. Anyone that says there's one answer, I think is a bit, they're missing the point a bit. But certainly one of the most common variables that I see in coaching and in the work I do is the idea of self-efficacy, the belief, and this is what I try to enhance in clients, I suppose, the belief that you can influence your world and you can make positive changes and therefore achieve your goals, whatever they might be. So.
Right. And what does it look like when you meet people, or before you meet people and when you meet people? Can you tell me about the process?
For the individual coaching?
Yeah.
Because it's obviously different when if I'm doing a keynote speak, I don't meet them at all. I'll walk into the audience. But even then, I suppose, I will try to understand the audience. So I will speak to the conference organisers or whoever it might be, and because it's important to try to understand who they are. And I suppose it's the same with individuals. Before someone walks into this room, say, and sits down, they would usually have they've either made a phone call or sent an email or made some contact. We will then make some contact back in return, either a return phone call or via email, to find out a bit about them. Sometimes we will actually send them psychometric questionnaires before they come in, and that. The process there is designed to understand, firstly, can we actually help that person? Because there's some people that we might refer on.
Yeah.
If they're, with specialised problems, we don't, we've got a small team here and we've got pretty general experience, and most things that come in the door or come in the phone, we can help. But there are times when I know some real experts in very specific areas. So the first point of call, I suppose, is to understand, are we the best people? Can we help them? If not, should we send them off to somewhere else? But if we think we can, then we'll get them in for a first interview, and we'll make it very clear in that first interview that part of the assessment is not just understanding where they're at and what they want to achieve, but again, whether we're the best people to help them or not, and if not, then who might be better.
Yeah, right. And what happens then first time you meet them?
Typically, so if we're talking about the individual coaching or therapy, typically they'll come in here for somewhere between a 1 and 2 hour interview / assessment, and that's pretty typical. So we'll ask them a whole bunch of questions, basically. Who are they? What's going on? What sorts of challenges are they facing? What do they want to achieve? Etc. etc. As I said, depending on who it is, that might involve some questionnaires, some formal psychometric questionnaires as well. At the end of that, we would typically provide them with some feedback and say, okay, this is what I think is going on. It seems you have these diagnoses or these issues, and this is what you want to achieve. This is what you need to get there. I think you'd be better off seeing this person, or I think I can help you, and this is what it would involve. Is that what you're expecting? So we always assess their expectations, their understanding of what they would get here. And if all of that fits together, if all of that matches, if I think I can help you and you like the look of me or the sound of what I'm offering, then we basically just set up another appointment or a series of appointments.
Right. And what would happen in would anything be going on between this appointment and the next session?
Very much so. So again, even going back to my clinical psychology days, but certainly through coaching psychology, I'm a big believer in homework, or in between session assignments, whatever you want to call them. I've always thought, and I still think, that what goes on outside of this room is just as, if not more important, as what goes on inside the room. So, so yes, in between every appointment, I will always send them off with something to do. Now that will vary from filling out questionnaires, completing monitoring forms. Sometimes it might just be some reading or visiting a particular website. You know, more and more might be visiting a particular website, or it might be what we traditionally used to call behavioural experiments, or you know, setting them up to go and try something new and monitor their response on how they go. So it could be any or all of those things, and then obviously they'll come back and we'll see how they go with that. We'll check in and reinforce any progress they made, reward any achievements, and then problem solve any difficulties they had. And that will then feed into the next session, and it's you know, we'll build on that.
So just to be even more specific, so when they come back and they've done an assignment, what would you say?
Well, I'll check in and see how that. So, well, the first thing, okay, so a typical session after that first one would be I guess what I loosely call a check-in. How you going? How's your week or fortnight or whatever it's been? How's it been? So any particular issues that have come up in that last week or fortnight, if there's anything important, we will note that down, but then I will check in their homework. So, okay, I sent you off to go and do A, B, C. Have you done it? If they haven't done it, then that's another issue. So for whatever reason they haven't done it, then I would check, well, did you not understand it? Did you not feel capable of doing it? Or what do we need to do to help you do that? Or do we need to change it in some way? If they have done it, then we'll look at how they went. So, you know, did you achieve what we set out to achieve? If so, then pile on the positive reinforcement. If not, then again, problem solving. And that will then typically lead in to the next stage. So the next stage will either be, if they haven't done it or it hasn't been successful, finding another way to do it, or doing it in a slightly different way, doing something different that might make more sense to them or be more achievable. Or moving on the next step, because typically that homework assignment is just the first. So if we've set our goals, that's the first step, and then we move on to the second step or whatever that might involve.
And the goal setting, would that have been part of the first interview?
So yeah, so that's very much part of the first interview, but it's also an ongoing process. So, and depending on the person and the nature of the issues, that assessment will almost always go beyond the first session as well. It's very rare that I would understand everything I need to know about a person in an hour, or even in 2 hours.
Yeah.
So assessment's an ongoing process, for me anyway, and goal setting's an ongoing process that we continually review and sometimes modify. Sometimes you can get that all done in the first session if it's a relatively straightforward issue, but more often than not, we keep revising the assessment, revising what I call formulation, the model, the conceptualization, and therefore revising the goals as well. Because often, I guess what we've got to remember is that one of the reasons people are sometimes coming to see me is that they don't know what their goals are.
Yeah.
That's part of the process. So,
yeah.
So again, it's unrealistic to assume you'll answer all those questions in the first session. Sometimes that's the whole goal, is to clarify the goals. So yes, all of that is ongoing, and all of that reviews, but I guess most of the time I would have a fairly good idea of the assessment, the formulation or conceptualization, what the goals are within at least the first 2 sessions, and we're starting on, and so we've worked out the plan to achieve those goals, and you can start on that within the first couple of sessions, and then again it depends what it is. I mean, sometimes it might only be 2 or 3 sessions if it's a very defined, I mean it's pretty rare, but if it's very defined, very clear, they just need to go and do 1 or 2 things, or maybe learn 1 or 2 skills, and that's it. More often than not it'll take longer than that, but it's, how long's a piece of string? Anything from 5 or 6 sessions through to 50 or 60 sometimes. Not often that much, but
right. And so in a session, do you follow a process or a structure, or is it different from time to time?
Look, it does vary a bit from client to client. It depends on what they like, what works for them, and also the nature of their problem. But I do tend to follow. I'm a fairly structured person. I was trained predominantly in a cognitive behavioural approach. That's a fairly structured approach. And so, typically a session will involve a check-in review of the week, review of the homework, and whatever that involves. discussion of the key issue for that week, and so that could be anything from teaching them a new skill. I mean, if it's cognitive therapy based, then it will be asking them various questions, reviewing particular situations, etc., and then setting them up for the next week or fortnight. So then we'll be setting up or leading into the next homework assignment. So and answer any questions they have about that. So it's fairly structured, and depending on the client, I mean, I'm obviously flexible with that. Some clients I work within a 50-55 minute time frame. Others will have 1.5 to 2 hours, again depending on them and the frequency. But yeah, I prefer, and I think most of my clients prefer, to have a fairly structured session, so that they're getting the most out of it, because most of them are fairly busy. They want to get the most out of that hour or whatever it's going to be.
Yeah.
And without that structure, I think it's too easy to get sidetracked or go off on tangents, and then the hour's up, and well, what have we done?
Yeah. And is that the same for coaching and clinical psychology?
Pretty much. Yeah.
And how do you end an engagement?
Well, so all along the way, we're monitoring progress towards a particular goal, or goals. There's usually more than one goal. So, one of the simplest measures I would use is what's often called a goal attainment scale. I don't know if you've... So, we've got a specific goal, and we've defined that. We know exactly what it is, and if you've come in and you've ticked that off, then hey, happy days. See you later. Now, that doesn't just happen overnight, so we know when we're getting closer and closer to that. So if someone's achieved their goals, or if we're not making progress anymore, we will monitor that all along the way. And my approach is a very open approach, so I'm very open and honest, and I will say all along the way, this won't go on forever. I make that clear from the very beginning. My goal is to make myself redundant, and my goal is to make you your own therapist, your own coach, so you can manage not just this particular issue but future issues. So if you're my client, you know from the very beginning that this is time limited.
Yeah.
Now I think there's been confusion over the years between time limited and short term. It doesn't necessarily mean short term, it depends a lot on the person and the nature of problems, but all along the way I'm tracking and I'm feeding back to them our progress towards the goal, and as we're getting closer, they know that, and we start to talk about discharge, or what I used to call discharge or termination, whatever you want to call it, from all the way through really. So when this is finished, how are you going to cope on your own? How do we set up relapse plans, or how do you bounce back when you have a difficult time? All of that happens from the very beginning. I don't see relapse prevention as just something you tack on the end. It's built in from the very beginning.
Right.
Alternatively, if we're not making progress, then again that's something I discuss quite openly. So what's going on, and either we need to identify why we're not and fix it, or for some reason, not all clients get better obviously, or not all of them get better with me. Sometimes it's just not. So again, if they're not making progress, and if we've discussed that and we can't resolve it, or we can't work out why, then we might discuss that and discuss either just finishing there and accepting that this is the way it's going to be, or more often than not looking at other options and considering another coach or another therapist, because even though I'm pretty confident in my competency, I'm confident in what I can do, I'm not perfect, and I know I can't, and I'm not necessarily perfect for everyone. So even if I was perfect for you, I might not necessarily be perfect for the next person that comes along. And I think all therapists and coaches should keep that in mind. That
you said monitoring progress. How do you do that if the goals are moving targets?
Well, that's a difficult thing. So well, it shouldn't be moving that much. I mean, sometimes it does change, because certainly as people get more confident, as they get happier, as they then sometimes they see more and more potential. So and this is a really important point, I think, if someone comes in for a first session and sets their goal, say I want to achieve A, B, C, sometimes after the 5 or 6 sessions, if they're feeling a lot happier, a lot more confident, A and B and C might not seem good enough anymore. They might think, oh, well, I can do more than that. I can achieve much more. So then we do need to change the goals, but still they should still be fairly specific and measurable, and you're familiar with the SMART acronym. Yeah. So all of those things still apply. The SMART measures might change a bit, but you're still tracking towards something. Maybe it means it's going to take 20 sessions rather than just 10 because everything's got bigger, but you're still working towards that. And look, sometimes it might just continue on for a long time, and I don't see that as a bad thing. I don't. you know, I've never been into long-term psychotherapy that goes on for years and years, but that doesn't mean it's not appropriate for some people. If they're, I guess my bottom, if you're still making progress and you're still getting value out of what I'm offering, then I'll keep working with you for as long as you continue to get value and make progress.
Right. You mentioned some of the questionnaires. You're using different questionnaires. Can you say something more?
Yeah, well, so historically in the clinical psychology practice we use a couple of, so the most common we use is the DASS, which is the Depression, Anxiety and Stress Scale. It's just a nice simple measure that measures depression, anxiety and stress, so it's a really good measure. We've got a whole bunch of other specific ones we'll use for specific problems. So we have in the past seen a lot of chronic pain patients, so we've used a number of pain measurements. We've got specific anxiety measurements that we use. So it's in the clinical psychology area, there are literally thousands of, and we've just basically got a library of questionnaires we use that we'll pick and choose depending on the particular person, including general measures of self-efficacy and locus of control and happiness and well-being. In the coaching area, it's a bit more, it varies a bit. So we probably don't use quite as many, although with some of the organisations that we work with, they have their own measures that we'll work around. From the positive psychology space, it's not really a questionnaire as such, but the one that we probably use most is the VIA Strengths Survey. So that's not it's obviously not a questionnaire, and you don't get a score out of it, so it doesn't rank you in the way, but I think it's fantastically useful, and that's, you know, a big part, particularly our positive psychology coaching and the leadership coaching, a lot of it is strengths based, so we use that quite a lot. And some of the organisations we work with use other strengths based questionnaires, so some of them we use the Gallup Strengths Finder, and there's a few new ones that Realise too that are starting to be used. So if they're already using it, we won't come in and change it, or so we'll just work around whatever they're using. There's a whole bunch of other measures that some companies use, and we'll try and understand them as best we can and work with them.
Right. And how do you use assessments? Like what do you do with it?
Well, so traditionally in the clinical psychology space, we use it as an outcome measure partly, and as part of our assessment and formulation. So, for example, if we'll talk about depression because it's one of the most common and easiest to understand, so we'll take a measure of depression. We'll use the DASS because that has a depression score within it, and so one of our measures of success will be. Are you familiar with the DASS? Okay, so if there's basically there's normal, moderate, severe levels. So one of our goals will be to get them in the quote-unquote normal level, below the cut-off score. So we use it partly as the assessment and as an outcome measure. But obviously we'd also look at specific items within that and use that as point of discussion. If they're reporting scoring high on a particular sleep disturbance, say, or irritability with others or something like that, we'll use that as to feed into the therapy and the discussions, etc. So that's a pretty traditional approach. And in coaching, we'd use the same thing. Although again, in coaching, we tend to use more like goal attainment scales and sort of tracking progress towards that, and knowing when, or if or when we are making progress, and if not, then we need to talk about it.
Right. And you mentioned the VIA. So how do you use the VIA?
We use that in a number of ways. Not obviously not as an outcome measure in the same way, because that's not what it's supposed. But if nothing else, it's a great introduction because a lot of our clients haven't heard of it, or more and more have. I mean, when we first started using it, whatever, 5 or 6 years or however long ago, 7 or 8 years ago, maybe, I can't remember now. Not many people had heard of it at all, so it was a great way of introducing people to the idea of strengths, the idea of positive psychology, to get them to think they have strengths. I mean, some of our clients had never thought about that. All they've ever thought about is their weaknesses.
Yeah.
So just completing the questionnaire for a lot of people can be quite therapeutic. In fact, I've had clients who have, I've sent them off to answer it online, and they've come back and said they were in tears because they'd never thought they had strengths, and that's remarkably powerful, and it's great. So just to introduce the idea that everyone has strengths, and that we can use, and then, like I said, then how do we use them? How do we maximise our potential by using our strengths? That's probably how we use it most. And as a starting point, I think there's been some really interesting research about strengths over the last few years, and when I first started using it, it was pretty much about take your top 5 and focus on them, and pretty much forgot about the others, and how do we use them as much as possible and in many situations as possible. Now, it's a fascinating area. Now people are always saying, well, we should look at more than just the top 5, and maybe there are other ones that we can look at and specifically develop. We've also got to be careful about overusing strengths.
Yeah.
Every strength has a dark side. And so I guess the simple answer to your question is, one, it's a way of highlighting for particular individuals what their strengths are. Two, it's a way of starting that discussion, getting them to think about that. Because I think if nothing else, if they can walk out of here thinking, well, I have strengths and I can use them in all sorts of situations, that in itself is a pretty powerful realisation.
Yeah. So would they normally answer a questionnaire at home and then bring the
Yeah, more often not. Sometimes we'll even get them to do it before they come in, depending on, before the first meeting even, we'll say, we'll just send them the link to the video or to... But no, more often than not after the first session, we'll send them home. And we'll either just tell them describe how to get to the website, or we'll email them the link, tell them to fill it out, print out the results, and bring it back in, and we'll talk about it, and get them to see what they think about it.
And so when they bring it back and you talk about it, so what do you say?
Well, my first question would often be, what do you think about it? Most people will say something like, it wasn't a huge surprise. Most people will say, it's, that's kind of what I would have thought. For some people it is a surprise, so depending on their answer, what did you think about it? Oh, I was totally shocked, I never knew. Well, why were you surprised? Why didn't you know you had jazz strengths? Sometimes that will come down to just language. Maybe they have thought about those things, but they've just used different words. Or, But so my first thing would be, what do you think about it? And then, what do you think we can do with that? Do you think it would be useful to develop these further, to use them in different areas? And if so, then we start to talk about how.
Right. Let's see. And then when you said you use them as in an ongoing process of monitoring, so can you say something? So the person will have to take the assessment several times?
Well, not always, because I don't. No, not really. I didn't mean like that. Because I don't know. I don't think it's a sort of measure that you would get someone to do every week or every month, because I wouldn't expect it. It shouldn't really change all that much. I mean.
But the DAS or some other measures?
Oh, well, that we would do, yeah. So the DAS we might do, well, depending on the client. Not necessarily every week. I mean, sometimes we might, but more often than not. Well, it just depends on them and their level of severity. But maybe every month or every couple of months, just depends. But certainly those ones we'll use to track, or even just a simple, 0 to 10, rate your mood sort of thing, which we'll just do verbally, and we record in our notes and track it. But with the strengths though, we wouldn't do it that often, but we would check back on it. So what I'd personally do with it, so I don't have it here, but with each client I've got a file and keep the notes in, and I actually write on the front of their file, which has their name and contact details, I actually write their top 5 strengths and any other strengths that are particularly important. So every time I sit down with them, it's right there with me. Yeah. And that helps me, so that when I look at that particular person, I think about them in terms of strengths, and it helps me remember what to bring into various conversations. So for example, if they're coming in and we're talking about a particularly challenging problem that they've had in the last week or month, and I will look at this also, have you, one of your top strengths is curiosity. Have you been using that? Have you thought about one of your top strengths is courage, or whatever it might be. Have you thought about using that? And because they'll often forget if they're not used to doing it very often, particularly in the early stages. So that's how I'll keep referring back to that literally every session, and I make it very clear on my notes. And I encourage them to do the same. I encourage them to print it out or write it out somehow or other, and some of them, if they're a bit more creative, they'll come up with all sorts of ideas, but stick it next to their computer or somewhere where they'll see it. Often one woman that I saw a while ago actually made this great sort of like a vision board, I suppose, if you know what those are like she was quite creative, so she made this great image that highlighted all of her strengths and how she wanted to use them, and then she took a photo, and that became her background on her iPhone. That was quite good actually. So every time she turned on her phone, she saw this. That was great for her. So I encourage people. I mean, I can't remember, but I guess I'm pretty sure one of her top strengths was creativity. Yeah. So it was using that to use her strengths and to make the most of make the best of any situation she could. So. Yeah.
What about positive interventions? Do you use certain interventions?
Yeah. Well, look, I've been trained and brought up to use evidence-based approach. So there are a range of evidence-based positive psychology interventions, obviously. So utilising strengths, finding new ways to utilise your strengths, is one of the ones that's been proven to work. So I do a lot of that, as we've just talked about. Gratitude diaries, gratitude journals, gratitude letters, visits. That's personally something I've found very helpful, but also 99.9% of my clients have found helpful in some way or other. It's obviously, like all of these things, they need to be tweaked and individualised. But certainly, in clarifying goals or clarifying direction and meaning and purpose, I see that's probably a big one. Actually, I see a lot of people that come in, particularly in the executive coaching space, who are very successful, quote unquote, big jobs, lots of money, big house, fast car, but they're kind of lost in some way, and they, I don't know, why am I doing this? What's the point? So. There's, I don't know if there's not necessarily specific interventions in the same way, but certainly the work around finding purpose and meaning is something I find quite fascinating, and a lot of my clients do and find necessary. So helping them clarify their life goals, purpose, meaning, whatever you want to call it, definitely identifying strengths and finding ways to use that, building hope and optimism. So I've been very much influenced by my cognitive therapy background, but I see, the positive psychology aspect of that, really just a continuation of the early cognitive therapy. But I also do a lot of work around that, thinking styles and interpretation and attribution of style. Building positive relationships, I see is again not necessarily specific, or the interventions around that are maybe not as specific as something like the gratitude diary, but I mean, as Chris Peterson famously said, other people matter, and in some way or other, almost all of my clients can benefit from focusing on their relationships, their intimate relationships, but also their often it's workplace relationships. And I suppose the other thing that I focus quite a bit on, although I'm aware of my limitations, and that I'm a psychologist, so and I try not to go beyond my area of expertise, but I think one of the areas that positive psychology is ignored a little bit, but there's a lot of research to support, are the benefits of physical health. Yeah. So although I'm not a nutritionist, I'm not an exercise physiologist, I do very much encourage people to engage in healthy behaviours. Yeah. And I feel confident enough about doing that from a behavioural point of view. Now there are times when I'll refer someone to a nutritionist, for example. So one of my clients at the moment, who's a partner of a law firm, and most of the issues we're dealing with are psychological issues, but he's also overweight. Now I'm helping him a lot with that, but I've also referred him to a good friend of mine who's a very good nutritionist, and she's helping him around specifics of diet, and and I think that's really important. What we eat is important, yeah. Whether or not we exercise. I mean, there is good research around the benefits of exercise, etc. So that's another. I mean, their interventions, I suppose, particularly exercise, and also, I suppose, what borders it. I mean, things like meditation and applied relaxation that I use a lot. There, I suppose. So what I mean, that's a brief run through, but I suppose for every client I will bring together some combination of all of those things, depending on their particular presentation needs, and create an individual program in a sense.
Right. And just to, I'd like to ask a few questions for examples. Okay, so what would be an example of working on purpose and meaning? Like, what could it look like?
Well, again, it depends. I mean, there's a paper that I found quite interesting by it was Todd Kashdan was one of the authors, and I can't remember who the other. There was 2 or 3 authors, and it was it was a theoretical paper, but they described 3 paths to finding purpose and meaning. One of which was looking to I can't remember what they called it now, but it was like social modelling. So finding an idol or a hero. And I suppose, to use a cliche, it could be someone like Gandhi or Nelson Mandela or Mother Teresa or one of these sort of people, but it could be someone more local. It could be a father or a mentor. And so if you idolise someone, so what is it about them that you idolise, and what about the way they live their lives? So I would often ask someone to think about, who do they idolise, who do they admire and respect, what is it about that person, how do they live their lives, and how and it's not necessarily about copying, because they need to understand they're different, but how could you live your life in a way that's consistent with that, so that you can also be happy and successful. So it's ones that looking up to others. One is just through trial and error. So it's just trying different things, whether it's different jobs or different hobbies or different whatever, and finding out what works. And the other is more through sort of learning, so reading self-help books or seeing a coach or therapist. So I'd encourage them to try one or all of that, and they're not mutually exclusive. You can do all of those sorts of things. But the idea, I think it's important that I mean the happiest, most successful people that I've seen or met or read about or worked with seem to have a pretty clear idea about who they are and how they want to live their lives.
Yeah.
And so that's, in some way or other, that's an important part of any coaching assignment that I'm involved in.
Right. And then you also mentioned building hope and optimism. So how would you go about doing that?
Well, that ties into what we just talked about, I suppose. So having a clear vision of the future engenders hope. Not having a clear vision engenders hopelessness almost, or can be, a form of pessimism, I suppose. So hope, I suppose I would define hope as the belief that things can be good, things can be better. And that's partly around having that clear vision. It's partly around building self-efficacy. I think I talked about that a bit earlier, the belief that you can influence your life and your future. And that will come about largely through behavioural experiments, so get people to... so in some cases, I suppose traditionally, from a clinical psychology background, would be things like graded exposure. What do you find confronting or difficult or anxiety-provoking? Let's face up to that. And one of the things through, by doing, and maybe in a gradual way, but by doing that, by confronting your fears, by facing things that previously made you anxious, and overcoming that builds confidence and self-efficacy. And then the idea is, well, if I can do that, what else can I do?
Yeah.
If I can do all these things, well, hey, this is, how exciting is that? So that's, but then also through, again, more traditional sort of cognitive therapy, questioning and discussion type techniques as well.
Right. And the building of positive relationships, how would you go about addressing that?
Again, it varies a lot. Depends whether I'm talking about my wife or my colleague or my children or my friends. But basically, and it will vary depending on not just the nature of the relationship, but the person, etc. But there are ways of, so sometimes it's about building compassion and love. It might be more about communication skills and listening skills, a very practical sort of approach. It might be around looking for positives in others. So this is something I probably spend a lot of time on doing, encouraging people that have problematic relationships often find it too easy to see all the problems in the other person, all the negatives. So this is another way that I use the strengths approach, I suppose, not just looking at and understanding your own strengths, but strength spotting in others.
Yeah.
And in the workplace, particularly, we found that very helpful, but also in intimate relationships, in any husband, wife, boyfriend, girlfriend, we all have faults, and that's fine. I mean, that's it's about being human. So it's not about looking at the other person saying they're perfect, they're fantastic, but it is about looking and saying, okay, well, she's got these faults, but she's also got these strengths, and I suppose we want to encourage them to focus more on the strengths. And look for the good in others. So sometimes it's about building or repairing trust and respect. It varies a lot from person to person and relationship to relationship, but some of the big ones, I suppose, are communication skills, which involves listening skills, I suppose, strength spotting in others, positive reinforcement. So for parents and managers, a lot of time on training them to reinforce positive, desirable behaviours as opposed to trying to punish negative ones. So that's, which builds positive relationships.
Yeah. And you also gave an example of physical health before. So can you say a little bit more, like how would you address it if a person needed to lose weight or change diet?
Well, that's actually, I've been spending most of the last few years working on that. Actually, I've developed a positive psychology approach to weight management. And it's basically using all of the same sorts of things that we've talked about. My approach to that is, because I started off doing a lot of research on this a few years ago, and found when I looked at a lot of diets and weight loss programs, they were very punitive, very negative, and sometimes quite abusive. They were actually saying, you're fat because you're lazy and ill-disciplined. And when I spoke to a lot of people who tried a lot, and there's lots in Australia, I'm not sure what it's like where you come from, but unfortunately we have a lot of overweight people. Yeah. I think we're second in the world only to America. So it's a big problem and a serious problem because it leads to all sorts of other health components. But when I spoke to a lot of these people who tried lots of diets and weight programs, many of them felt miserable, they felt abused, and I couldn't help but think, if you're feeling miserable and depressed, surely that's not the best place to be in to try to make lifestyle changes.
No.
Now we know when people are depressed, for example, they tend to do less helpful things, they tend to socially isolate, become less active, etc. And that's what so a lot of people seem to be stuck in this vicious cycle of sort of misery, and then, you know, I'll be happy when, so what I came to call the tyranny of when, I'll be happy when I lose weight. But because they were so miserable, they weren't motivated enough to do what they needed to do. So what I developed a program largely based on positive psychology and based on what I came to call the primacy of positivity. So the idea was that if we can get you happy first, or create meaning, and not just slapping on a fake smile, but real and meaningful happiness, positivity. If you can feel good about yourself first and foremost, not when you lose weight, but now, just feel good about yourself first and foremost, that's going to be energizing, motivating, inspiring. You're going to be more likely to do what you need to do, and you do need to do stuff, whether it's, you know, eat less or exercise more. But if you're feeling good about yourself, you care about yourself, you're going to be more likely to want to look after yourself. So all of the positivity will lead to you being more likely to do what you need to do to then lose weight. So we've built this program which is about getting people to feel good first by identifying their strengths. And again, because a lot of those people only ever think about their weaknesses.
Yeah.
I'm weak, I'm ill-disciplined, I failed at everything. And we say, well, okay, but you've got creativity and you love learning and you whatever. And so, okay, and then how can we identify those and feel good about those and treasure those, and then how can we use them? It's about, again, about building hope and optimism. Many of them have failed multiple times, so it's not surprising they feel hopeless. But I'll get them to look at successes in other areas of their life. And amazingly, well, maybe not that surprisingly, although they've often failed multiple times in dieting or weight loss, they've often had amazing successes in other areas. So they're a great mum, or they're a fantastic lawyer, or whatever it might be. And then we'll say, okay, what have you used to succeed in those other areas, and how can we bring it into this particular domain? Because many of them are very, very successful in some other area or many other areas. So it's about building on previous successes, recognizing those successes, feeling good about those successes, identifying their strengths, creating a positive vision that's not just about kilograms or dress sizes. And this is where I think a lot of other diets go wrong, is they're just too limited. So my program's called the Happiness Diet, and the ultimate goal of the Happiness Diet is not just weight loss. The ultimate goal is living a great life, a healthy life. So we also get them to redefine their outcome. Healthiness is not just about being skinny for some people. Many of them have very unrealistic goals. You know, for many of them expect to lose too much weight. They're just never going to do it. You know, they look at the covers of magazines, and so we get them to redefine that in a very positive way, but also a more realistic way. We get them to look at a great life that's beyond losing weight. Now, they need to lose weight, but maybe not as much as they think they do, and maybe there are other things as well as losing weight, having better quality relationships, more fulfilling job, etc., etc. And so by using all of those principles of positive psychology, and this is what people say, they feel alive again. They feel so you're much more likely to go for a walk or go to the gym, or you know, if you're feeling good about yourself. If you feel totally crap and hopeless and worthless, well, who cares what you put in your mouth? I'm a hopeless, worthless, useless thing anyway, so I might as well eat all that crappy food. But if I feel good about myself, and if I love myself, well, then I do care what I put in, and I'm going to eat a bit better. And so that's how we. And then, as I said, I'm very careful not to go beyond my area of expertise. So where necessary, often we will encourage them to see experts in nutrition and maybe exercise. But also, you know, it's not that complicated. Healthy living, I mean, exercise, for example, shouldn't be complicated.
No.
Anyone can go for a walk. And for a lot of these people, that's where they need to start, you know. They don't need some fancy exercise program. They just need to get off their bums and go for a walk. We also encourage them to find fun ways to exercise, something they enjoy. So one of the clients I worked with recently, he just hated exercising. But she was a singer. She loved dancing. So, well, dance is a great form of exercise.
Yeah.
And it's like this little light went on her. She'd never thought about dancing as exercise before. But as soon as she did, she thought, well, gosh, I'd love to dance for an hour a day. Well, having fun, doing something she loves, and great form of exercise. So if we can get people to find fun ways to exercise, then they're going to be more likely to do it.
Yeah. You also mentioned meditation and relaxation.
Yep. So in more recent years, particularly, I've become interested in and integrated mindfulness into what we do, into the eating, into the happiness diet. So mindful eating is a part of what we do also. But just regular meditation and relaxation strategies. Now, I've always used that, I suppose, for 20 years, going back to, it was always a part of anxiety management and stress management, and even treatments for depression typically involve some sort of applied relaxation and meditation. And so I still use that in different ways. Now, again, it depends a lot on the person and the individual. For some people, I'll take a very, very practical approach and just teach them really simple. So I've got a little method I use. It's just absolutely the simplest form you can possibly do, just focusing on your breathing and repeating in and relax. That's just the basics. It focuses your mind on it's like a mantra, I suppose, but it's just saying in and relax, focusing on your breathing. And for some people, I just say, just do 2 or 3 minutes, 2 or 3 times a day. Because a lot of people think meditation, I've got to do an hour. Who's got an hour to do it? Yeah. Unless you're a Buddhist monk. So for some people, I'll keep it really simple, really practical. Other people, we will explore longer sessions and maybe go a bit deeper and look at other things. There's also use progressive muscular relaxation for some people. So it depends on them and what their goals are and how interested they are. But for most people, I will try to incorporate it in some way or other, because again, there's some really good research that people that meditate or relax regularly are healthier and happier. So it's just a pretty good skill to have.
What about knowledge sharing? Can you say something about that?
Yeah, look, that's a really interesting one, and I've had discussions with other coaches and psychologists about this before. Yeah, I was brought up, as I was trained in very much a cognitive behavioural approach, which was very much about not telling but questioning. So I was a lot of my training was about asking the right sorts of questions, and so that still is a big part of what I do. However, a part of our training was also what we used to call psychoeducation.
Yeah.
And I still think that is an important thing to do. So I will, and my colleagues will still often tell, I suppose, or provide information, share information around what is anxiety, for example, and what is normal anxiety. This is something I was just had a session the other day with a 10-year-old boy. Now I don't usually work a lot with kids, but it's actually the son of another client. And he's just been experiencing some anxiety around exams. And look, he's actually pretty good. He's coping pretty well, but so it's really just some fine tuning. But one of the things we talked about is what's normal, and that if you're about to sit an exam, it's normal to feel some anxiety. In fact, it's probably good, because if you're a bit aroused, your brain's going to work faster, etc. You don't want to be totally relaxed necessarily, because to get the maximum performance, you want a bit of arousal, all that. So for him, it was quite useful just to know that it's actually okay to have a bit of anxiety. And for a lot of the executives I work with, some of them over the years have worked with people who are anxious about speaking. So they're very high functioning, very intelligent, great at their jobs, but they're socially anxious. Yeah. And again, it's important. It's good for them to know that it's I speak a couple of times a week often, but I still get a bit anxious. I get aroused. So, and then how to redefine that it's excitement, not anxiety.
Yeah.
So yes, some education and certainly some sharing of research. Now again, I'll do that more or less for some clients. Some clients just aren't interested. No. They don't care. Just tell me what to do. But some clients are. So depending on the client and their level of insight and not necessarily intelligence, it's more about do they have a love of learning, I suppose. But if they do, and if they are interested, then I'll more than comfortably share with them some research findings as an introduction to, or as part of providing a rationale, I suppose, to a particular activity or exercise.
So just to make sure I understand, so before you would introduce an exercise, you would provide them with the rationale by explaining the...
Sometimes, but not always. So again, it depends on the client. Some clients aren't interested at all in the research, which sort of surprises me, because I would have thought, if I go to see my doctor and my doctor recommends something, I want to know that it's based on something. It's not just something she made up. But some people aren't. So again, it will very much depends on the particular individual or the audience. So for example, with my speaking, again, depending on who the audience is, if it's a general public audience, I tend not to refer to research that much. I'll do a little bit. But if I'm speaking to a room full of professionals, I will. So I was actually just talking to someone this morning about I'm speaking at a conference in a few months' time, but the audience will be psychologists, doctors, health professionals. So I will refer much more to research findings there. And it's the same with an individual, depending on who he or she is and what I think they need or are interested in. So I won't always share it, but often I will, but then at slightly different levels too.
Right.
Because I try to pitch it for and get the right level for that particular person.
Yeah. You also mentioned tweaking the way you work and individualizing it. Can you say something more about your flexibility?
Well, I use a lot of stories and metaphors, which I think helps. So, but I will use different stories and different metaphors for different people. So, for example, one of my clients that I'm seeing at the moment, he loves sport, and we go for the same football team, which is great. So we've got this great, really strong connection, and at the beginning of every session we'll typically chat about the weekend's results for a few minutes, not for an hour or so, obviously. But it's really good. It gives us that connection. And I will also often use with him sporting metaphors. And I don't know if you follow sport at all, but I think there's a lot we can learn from sport about performance and teamwork and strategy even. So for him, but then there are other clients who, if I talked about sport, they'd fall asleep, or they'd walk out. So I might talk about other things. You might talk more about music or art or research. So I suppose to provide a rationale and to make a point, I would talk a lot about story. Another client I had, I actually haven't seen her for a year or two now. We used to talk a lot about literature. I love reading, I love fiction, and so we'd talk about novels sometimes and classic characters from some novels and what we can learn from them. With my kids, I've done that. A few years ago now, but my daughter was madly into the Harry Potter, obviously phenomenal, and I always try to like to read what they're reading, because there's a point of connection again. And again, I thought there's some great lessons from that. So that was a great way of connecting and speaking at the same level, but also drawing out. One of the great things about Harry Potter, I thought, was that the main characters all had different strengths. I don't know if you've read the books at all.
No, I've seen the films. But no.
Okay, so they all have different strengths. Harry's strengths are very different to Ron and Hermione's, and that was but they worked together. They all worked together as a team quite well. One of them on their own probably wouldn't have been quite successful as all of them together. Yeah. So that's how I would tailor it, and I might be talking about strengths, for example, with 3 different people. But for one, I'll talk about from a sporting perspective, because strengths is very relevant in a sporting perspective. For another one, it might be literature, like Harry Potter, or someone else, it might be more of a purely research perspective.
So how do you use stories, or how do you use metaphors?
Just by talking about. So one of the things I think I'm quite good at is connecting with people, and I think I've got a quite good general knowledge, so I can connect to most people on some level, again, whether it's sport or music or whatever. And once I know that person and what they like or they're interested in, then I will talk about, let's just say, strengths from that particular angle. So we'll talk about a particular athlete or football player or whatever, and what does he do well, what does he not do well, how does he balance that, how does he use his strengths as best as possible, would it be the best player he can be? Does that make sense?
So you would introduce characters from that or introduce a metaphor into the conversation?
Yeah, well, I might say, so if we're talking about strengths, I might say, well, if we're looking at last week's game, we won the game. But we lost the week before. How did we do that? What did they do differently? And then I might get into talk about particular players and how they use their strengths differently. And then that's okay. So then, what can you learn from that?
Right.
How can you take that back to your office or back to your family? Or
Can you say something about the PERMA model?
Look, I think the PERMA model's a great model in lots of ways. I like it, it's memorable, and I certainly think it sums up most of the key factors. At least one area, however, where I think it's lacking is the physical health aspect, which it doesn't include at all, really. Now, I've heard Marty respond to that, saying that he believes that's just a sort of, I think his response was it's a mediating factor on the way to achievement or accomplishment, I think is where he placed it. But I would put it, I would see it as being far more significant than that. In fact, I've, at the risk of sounding self-promoting, I've developed a model probably 7 or 8 years ago, and it's an acronym called CHOOSE. And CHOOSE, for me, CHOOSE is a philosophy of taking responsibility for your life and the choices we make. But CHOOSE is also an acronym that stands for clarity, life goals and direction, healthy living, so which is diet, nutrition, sleep. So that's foremost in a number, sort of top level. O is for optimism. Second O is for others, relationships. S is for strengths, and E is about enjoying the moment and being grateful and having fun. So, but the point I want to make is that I would see the physical aspects of health as just as important as all the other ones, not necessarily a secondary. And so, if I was to make a criticism of PERMA, that would be one.
Right. I also have some questions about other factors that might be influencing outcomes. So one of them is the expectations, and we've talked a little bit about self-efficacy. Can you say something more about how you help people build positive expectations?
Largely through experience. I think I said I was primarily trained as a cognitive therapist. I was really trained as a cognitive behaviour therapist, and one of the most influential people in my career was really a behaviourist. He was just at I was trained on cognitive behaviour therapy, was at its peak, but my mentor was really trained as a behaviourist. So he always put a lot of emphasis on getting people to do stuff, not just the thinking. Now the thinking is obviously important. I went on and did some postdoctoral training with Aaron Beck and G.D. Beck, and also some other academics at Oxford who were very much cognitive therapists. So I was sort of a bit more at the cognitive therapy end. My mentor and supervisor, Pet, was at the behavioural end. But I think I'd like to think I sort of got the best of both worlds. But the most effective way I believe to change cognition is through behaviour and behavioural experiments and testing. And so that's how, if it comes to expectations, if someone says, I can't do something, well, let's try that out. Now, it's not necessarily about throwing them in the deep end, although sometimes that can be appropriate, but more often than not it might be building them up through a series of successive approximations, through shaping and modelling to build their confidence that yes, they can do something, or if they can't do that, well, they can do something else that might be just as good or to get around it. So I would help them. So it's very much a collaborative approach. We would design a series of steps, each of which would hopefully boost their confidence in themselves and their ability to do whatever they want to do.
Right. And so when you build the steps, what are the rules of thumb for how to do that?
Oh, well, essentially, yeah, I guess there are, but it's a very individual thing. It'll vary a lot for the client, but ultimately, for example, I guess to use a fairly straightforward example, if someone's afraid of heights, and so what's their ultimate goal? Now that might vary. For some people, I'll give you a slightly simpler one. Someone that I saw not that long ago who was arachnophobic, scared of spiders and other insects sort of bit. But now for some people the ultimate goal might be to hold a spider in their hand. Okay? Other people might not want to do that because most of us don't necessarily or aren't in a position to do that anyway. For someone else it might just actually be to be able to look at a spider behind a glass, like at a zoo, for example. Well, so the first thing, what's the ultimate goal? And that's going to vary a bit. But if it is, for example, if the ultimate goal is to hold a spider in their hand, then that would be number 10 on a 10-step process. Now, the next question is, where are they starting from? What level of anxiety? So for some people, the first step might actually be saying the word spider.
Yeah.
For some people, even talking about it is quite anxiety-provoking. But anyway, my rule of thumb will be, what's number 10? What's the ultimate goal? What's number 1? And these will vary. And then we're just trying to find 8 steps along the way that are roughly equal, but depending on what the nature of the task is, they won't always be perfectly equal. So that's just always a bit of give and take and a bit of negotiation, I suppose, with the client.
And then you
break it down. So so the first step is talking about spider. The second step might be maybe it's looking at a picture of a spider. Some people that's quite anxiety provoking. The next step might be holding a plastic spider or a toy spider. The next one might be you can get toy spiders that move in a little battery operated. So again, depending on what and then it might be again looking at or a real spider that's dead, then a real spider that's alive but 20 metres away across the room. And then, so you're just basically getting closer and closer to the ultimate goal. And yeah, we would, so we'd set that out. And now some people might go through that a session at a time. Some people might need a couple of sessions at certain levels, but for each session they have to, so we expose them to the feared stimulus. They would typically have an increase in anxiety, and so we get them to rate their SUDS level, subjective units of distress, an anxiety rating. If their anxiety doesn't go up, then you haven't designed your thing properly, because it should go up. That's the nature of it. So say if their anxiety goes up to 70 or 80, the idea then is to stay with that stimulus, stay in the situation for as long as it takes for the anxiety to reduce again. Now, it doesn't need to come down to zero, but and once they've done that, we move up to the next level. So once they can sit with a particular, say it's a toy spider, once they can sit there with minimal anxiety, then we move up to whatever the next step is. And so that's with that's a therapy approach to a form of psychopathology, but basically the same approach works with more positive goals as well, a step-by-step approach. So
by doing the behavior, you can change the way they think about it.
Well, exactly. So at the end, okay, so something that a client that I've actually just finished doing a big TV show, and it involved, every week we had what we call breakthrough challenges, which are basically these sorts of things. And one of the clients was afraid of heights, and she ultimately we went skydiving,
right?
And including myself, jumped out of an aeroplane. I don't know if you've ever done that, but
once.
Yeah, it was fantastic. I loved it. But anyway, she started off saying there's no way she would do it. She said, you got a 0 chance of getting me up there. Cut a long story short, she got up there, she did it, and the first thing she said when she landed was, I want to go and do it again. Now so I looked at that in two ways. One, it was a way of confronting her fear of heights and overcoming that, and she learned from that. And I asked her, what did you do? Well, I can do that. It was still scary, as it's supposed to be, but I can, and I suppose this is the most important thing, I can do it despite the fear. Not do it without fear, do it despite the fear. But the next question was, well, okay, if you can do that, what else can you do? And she actually responded. I mean, she was still a bit high from the adrenaline, but she basically said, I can do anything now. And I spoke to her later, a few days and weeks later, and she said it was literally life-changing. If I can do that, then I think I can do so much more with my life. And that's a wonderful, and that's what I would, that's where you'd love all of our clients to say, that I can, I can achieve almost anything I want to achieve. I say almost because, I'm never going to be an Olympic athlete. I'm never going to perform, at Wembley in front of 50,000 screaming fans. I don't have the athletic or musical talent, but there are lots of other things that I can achieve. So as long as our goals are reasonable and realistic, we should, and many people can achieve a lot more than they think they can.
Yeah. What about the way that you relate to your clients? How do you create and maintain a good working alliance?
Yeah, look, that's something that's, I often, I've done a lot of supervision and training over the years for younger psychologists and coaches, and I often refer to the science and the art of therapy or coaching. The science is about looking at these evidence-based, learning specific therapeutic skills or coaching skills, looking at evidence-based interventions like the gratitude journal or whatever it might be, and applying them. And that's kind of easy. I mean, it's not easy, but it's not that hard to take a reasonably intelligent person, teach them a few basic skills, teach them some interventions. What separates the best coaches and therapists and whatever is the art, I think, and that's a little bit harder to define. I think I'm actually just quite good at connecting with people, and I think I can describe that in some ways. Part of it is I'm genuinely interested in people. I'm fascinated, and so even when I'm not working, I'm often reading about people or watching documentaries about people and trying to love to know what makes people tick. Why do they do what they do? So that's one of my strengths, I suppose. I have both a love of learning but also social intelligence. So I think some people are just naturally good at that. How do I do that? And well, I genuinely show interest in them by asking them questions, and by through both non-verbal and verbal responses show that I'm interested in their answers. When if someone mentions something, I will, because I am generally, I will often bring it up in the next session, or I'll maybe send them links to interesting articles about that. So by doing that, I'm showing them that I'm interested, which is I genuinely am. and I'm continually reinforcing that every session and between sessions. And as I said, I have one of the things that I do, partly because I have a love of learning, but I read very widely. So again, I can talk to most people about most. Now, I'm not an expert in every area, but I know enough about most things to, even the economy or even politics, which I don't have a huge interest in, but I keep up to date. I read the papers every day, so that any client that walks in, I can usually find something to talk to them about. So it's one, by being genuinely interested in, two, by showing that interest via my responses, and by following up. So I don't just keep my contact to the sort of 1 hour sessions. I will often send them texts or emails or things in between, or you might be interested in this, or remember to do that. And that I think some psychologists and coaches, as soon as they walk out the door, they forget about them.
Yeah.
I don't tend not to do that. So I think all of those things add up to, if I'm genuinely interested in you and I show that interest, will more often than not, that will then go two ways.
And what do you do to help your clients stay engaged in the process of working towards their goals? Yeah, so homework would be one thing. What else do you do?
Well, I think the other part of my creative approach is to keep it fun and interesting. So I have, and more people have spoken about this in recent years, but not many used to talk. But I will, there's all sorts of ways of teaching and helping people learn. Now, one of my strengths is love of learning. I love reading, so I'm more than happy to go off and read thousands of words, thousands of pages. Some clients are, and if they are, I will recommend books for them to read, but some aren't. So I suppose I'm relatively creative in finding other ways, and it might be going to watch a DVD or a movie. There's some great movies out there. It might be listening to music, it might be going to an art gallery, but all with the idea of thinking about whatever the particular issue is, and learning about that, or getting in and thinking about it. And I think too many psychologists, particularly, are too conservative in what they do. So I guess I'll try to make these sessions as fun. So try to use humour appropriately. Now that's a tricky one, because can backfire. But I'll try to use humour. I'll try to be creative. For some people who are also creative, rather than just writing stuff down, I'll get them to go and do a painting or a drawing or whatever they like. I'll get them to go and join a new club and whatever it might be. Because again, if they're interested in what they're doing and they find it fun, then they're going to do it more, and then they're going to get more out of it. So I suppose that's how I try to, by making it fun.
Right. And what do your clients tell you? What do they report back to you that is most helpful to them?
Well, that varies a lot. Well, I guess there's two ways of answering that. At a specific intervention level, it'll vary. For some people, for example, the gratitude visits, which I'm sure you're familiar with, for some people that's literally been life-changing, and that one thing in and of itself has just, been an incredibly powerful experience, and they'll, or the gratitude journal or gratitude diary. So for some people it might be a very specific intervention. It might be, the realization that my thoughts are not facts and I can change the way I think, and for a lot of people that's very powerful. Hey, you can control your thoughts. It sounds obvious to us, I think, but there are a lot of our clients out there, the idea that their thoughts are not facts, some of their thoughts are unhelpful, they can change their thoughts and therefore change their life. That's a very powerful message, and I think sometimes we underestimate that, because most psychologists and coaches have read so much about it and it seems so obvious. But so for some people it might be a very specific intervention, or as I said, identifying their strengths. But for other people it might be, I guess, what some people call one of the general factors or common factors. And so something like self-efficacy, which I sort of see as an underwriting or overriding sort of master, that just the belief that I can have a positive influence on my life. Which again, very powerful. So they're all a bit different. Sometimes it might be a specific strategy. Sometimes it might be something, a big overriding belief like that.
Right. And when you see changing clients, how do you find out that they're progressing? Was that through the use of assessments, 1 to 10, or? Yeah,
so it could be either we're tracking that through a specific question, so their DAS scores improving. they're making progress on their goal achievement scale, or on that exposure scale, whatever it might be, or just through feedback. I mean, every week again, I check in with them. What's happened this week? How'd you go with your homework? So if they've made progress with their homework, then they're making progress, and I will continually ask them, continually reflect on our ultimate goal, whatever that might be, and so we will know every session. I will know, they'll know. We talk about it very openly, if they're making progress towards that goal. And again, this is something I think I'm quite good at, is piling on positive reinforcement. Because I genuinely feel pleased for them, and that's fantastic. But then also encouraging them to reinforce and reward themselves, and getting them to get their friends, elicit support from friends to get them to reinforce it as well. So with weight management, for example. We'll almost always encourage them to find a buddy, or be part of a group, and encourage them to reinforce themselves. Not just about lost kilograms, although that's part, but other achievements as well.
Yeah. And what would you say are some of the most important effective factors or causal mechanisms that creates these changes in people?
I think what we've touched on already would be successfully engaging in particular behaviours that have subsequently changed their belief in something. So by doing, by walking into the zoo and walking up to that window and looking at a spider, I can now stand there with minimal anxiety, which I couldn't do before. So if I can do that, what else can I do? That belief, that confidence, self-efficacy, whatever. Or by jumping out of an aeroplane, I did something despite fear. Now again, that's the belief that we can do things despite fear, despite difficulty, despite distress, is a very important belief to have for life, because there will be distress in life, there will be anxiety. It's not about living a life without anxiety. That's never going to happen. So if I believe that no matter what I come up against, whatever challenges, whatever, that I can somehow or other get through it or around it or overcome it, then that's a pretty important belief, I think. We set them up for further success as well.
And other things that could influence the outcome?
Oh, well, there's the people around them, so there's their relationships, having supportive partners or colleagues or a buddy is very important. So I guess if we're looking at what influences outcome, I focus mostly on intrapersonal psychological variables, but context and environment is obviously important. I haven't talked a lot about that, but there's no doubt that the environment in which we live, both at home and in the workplace, say, or is very important. I mean, genetics plays a part, of course, depending on what we're talking about. I think it's sometimes overestimated, but it definitely has a part. So particularly with weight loss, for example, there's no doubt genetics plays a part. We play a part as well in what we eat and what we do. But so support. I mean, that was with weight loss, for example. This is another one that if I'm trying as hard as I can to lose weight, but if I go home, for example, and my wife, who maybe does most of the shopping and most of the cooking, if she doesn't really care about it, and she continues to cook maybe unhealthy food or serve large portions, that's going to make it really hard for me.
Yeah.
Or if I'm trying to give up smoke, we know from smoking research, for example, if I'm trying to give up smoking, but my wife or girlfriend or all my good friends, if all my best mates smoke, and every time I go and see them to socialise, they're all smoking, that's going to make it really hard for me. So. Yeah. The context in which we live, the people with whom we interact, we know that people who interact with smokers are more likely to smoke. People who spend more time with overweight people are more likely to be overweight. People that interact with people who are depressed, there's social and emotional contagion. So all of those things are important as well.
Right. And other things that you would say are important to the outcome? Context factors or
probably lots of other things. I mean, there's obviously you're learning history, so how you were brought up and what your parents taught you about what's right and wrong and how to deal with things. And if every time I saw my dad face a difficult circumstance, if he just sort of threw up his hands and curled up in a corner and started crying, which he didn't, but if that's what I saw and learned, then that will obviously have an effect. So our social learning, particularly parents, but also other mentors, those those things important. I'm not quite sure if you're looking for something specific.
No. I'm just looking for several things just to find out what would be some of the important variables and how would they kind of influence what's going on.
Well, I mean, that's why we touched on this a bit earlier, but there's what we used to call the therapeutic relationship, the coaching relationship, which is important, and that's why, so I'll continually monitor that, and particularly if we're not making progress, I will sometimes say, do you think it would be worth considering seeing another coach? I mean, you obviously have to choose your words carefully, but in doing that, what I want, although I want my clients to take responsibility for who they are and what they're doing, I've got to take some responsibility as well. And again, I'm not going to be perfect for everyone, and there are some people who, although I'm flexible and tailored, I do have a particular style, as we all do, and as good as that might be for one person, it might not be good for the next person. So that relationship and interaction, there might be times when someone else is better, maybe seeing one of my colleagues here, or maybe seeing someone completely different.
Right. And how do you develop as a professional?
Well, as I said, one of my strengths is love of learning, so I subscribe to a couple of the general positive psychology, and I probably read a new textbook every couple of weeks, every month. I'm on the Friends of Positive Psychology listserv. I don't know if you get those, the free emails. And that's a great way of. There's a lot of stuff there that I don't read, but it's a great way of, people will often mention new research or new books or new conferences, and I attend a lot of conferences. Through reading conferences, we have peer supervision in here on a regular basis. So luckily that's something I love to do, so it's not a problem at all. In fact, the problem is maybe spending too much time reading, because there's so much it's impossible to keep up with everything, as you probably know. So it's about trying to prioritise and spend the right amount of time in the right areas. But,
And when you learn something new, how does that get integrated into the way that you work?
I think it just does naturally. I was always brought up. I was trained in what we call the scientist practitioner model. So I was always trained in the idea that the science should influence your practice. And that, I guess that's just always been a part of how I think about things, how I do things. That's how we were taught, and our supervision always involved that. And I guess, so when I read something, it just, I don't know, I think it just naturally finds its way into my practice if it's something new or different, or I might slightly change the way I've done something in the past.
Right. And if you didn't know about positive psychology, what would be different about the way that you work? Like, what does it add?
It's a hard one, because it's been such a big part of my thinking for 10 years now, I suppose, or whatever it's been. So it's hard to think what it'd be like without it. But I suppose if positive psychology didn't exist, then I'd probably be doing what I was doing 10 years ago, which is more traditional cognitive behaviour therapy. Although that's evolved a lot. Positive psychology's influenced that, but so too have things like acceptance and mindfulness. So I'd probably be doing more of a contemporary form of cognitive behaviour therapy with all the traditional stuff plus more mindfulness and acceptance. When I do therapy now, it's very influenced by positive psychology, so it's hard to separate them completely.
So what is it that positive psychology is adding?
Well, I suppose a much greater focus on strengths. Much greater focus, as I think it was the one of the founders of Gallup who supposedly said that when
Clifton or
Don Clifton, so he said, for too often we've been asking what's wrong with people. What if we would ask what's right with people? So that's, the first half of my career, that's all I ever asked. What's wrong with you? What are your faults? What are your weaknesses? Now I spend most of my time saying what's right with you. What are your strengths? What are your positive attributes? So that would be that's the biggest difference by far. Focusing on and seeing, but also I suppose thinking about myself as a therapist and coach. What are my strengths? And I didn't really think about that before. Probably I just thought I'm a clinician and this is what I do. But now I think I'm probably even a better coach because I'm more aware of my own strengths and I work more with them, and obviously help my clients do the same.
Right. And are there things that we've not talked about that are important to understand the way that you work?
I think we've covered most things. What have we not touched on? I don't think so. I think we've. There probably are, but I think we've covered most things. I think.
And the way that you work with groups, is that very different from the way that you work with individuals?
Not really. I mean, not philosophically. The theory and approach is the same. The delivery is obviously different, and the so we obviously, if there's a group of 30 people, it can't be individualised as much. But the basic approach is the same. The basic philosophy is the same. The basic content's the same. Just whereas, I'm totally focused on you, and I can tailor every single word and every single thing to you. In a group, you can't do that. I can encourage them to think about tailoring it, and I would, in a group context, I'd always say something like, here are the basic principles. These are the building blocks, the foundations. We know this. I know this works, but it's up to each of you to find out how it will specifically work for you. Now, depending on the size of the group and the amount of time we have, we can then discuss that for a few individuals maybe, but we would never have time to go through all 30.
No.
I mean, even one of the longer courses I run is 3 full days, and even that we don't have time to go through every single person and individualise every single thing. So that would be the main difference. But the basic philosophy, the basic approach, the content is the same. It's just delivered in a slightly different way.
Right. And the way that you deliver it, is that more teaching or group exercises?
Depends a bit on different contexts. So sometimes I run a course through one of the universities that I'm attached to, which is pretty much teaching.
Yeah.
But even then, it's still interactive. There's still question and answer, there's still discussion. But there are others that are very much interactive. So that 3-day course, I probably do the bulk of the talking with some interaction, some Q&A. Other courses that I run, they do the bulk of the talking and the doing. Like a lot of it's me saying, do this, a particular exercise bit, and they're writing or thinking or whatever. So it varies depending on the context and the audience.
And what would your advice be to other people who'd like to start combining positive psychology with some kind of helping profession?
Well, first, I'd say is learn as much as you can about it. And now there's no shortage of books to read. There's no shortage of academic articles to read. So that's great. I mean, when I started out, there wasn't very much at all, which was good in that I knew pretty much everything there was to know, but bad in that it was a very limited field. But that's just normal. Now it's grown. So the good thing is there's so much stuff out there. There's so many people. So I'd say read as much as you can read. Connect to as many people as you can, and as you said, through LinkedIn and through the Friends of Positive Psychology listserv, and there's all sorts of groups that where you can learn and talk to people, find other people that live near you, and meet with them, and maybe set up peer discussion groups or whatever you can, and then it'll depend on where and how they work, because again, I primarily work as a clinical psychologist, coach, facilitator. But if they're working in, so I've worked a lot with HR professionals, human resource professionals, and I think that the principles of positive psychology have a lot to offer there, but in a slightly different way. I've worked a lot with schools and principals and teachers, and positive education is a really exciting area. Yeah. But again, there's a slightly different twist to it. So it's about understanding the basic principles and then finding out how they'll specifically work for you in your context or in your job or whatever it is you're doing.
Right. And last things, comments, thoughts?
No, look, I think we've covered a lot. Look, as you hopefully you can see, I'm pretty passionate about it. It's almost like what positive psychology is what I always wanted psychology to be before it was. And again, although I loved clinical and still love clinical psychology, positive psychology for me is the ultimate. It's the ultimate. And I think a couple of positive psychologists have said there will be a time, or there might be a time in the next few years, when we don't even need to refer to positive psychology because psychology would have all integrated, and that's fine. I don't really care what we call it. It's a bit of a political discussion in a way. But I hope, and it's already happening, that clinical psychology is already, people are talking about positive therapy, for example. So I hope that it becomes so standard, so accepted, that it just is part of everything that psychology is about, and I think it's already heading that way, which is great.